if they're in that group where they're anxious, or if they have a low baseline pregnancy rate, then they will get significant benefit out of it. And the research, the meta-analysis showed 3 acupuncture sessions or more is what was needed to have benefit from acupuncture in terms of fertility. So to answer your question, it depends.
Highly stressed, they still could just benefit just from
the pre and post. And this is what the randomized control trial that I talked about in 2018, while it showed physiologically the results were not that different, what it did show is that psychologically that women, there was another kind of arm of the study, and it showed that psychologically women did a lot better when they received that extra support through getting acupuncture. So I think that's something to keep in mind, because as we mentioned before, IVF can actually be quite stressful, and you know, some studies have compared it to being the same level of stress as undergoing cancer treatment.
Hi, I'm Marie Hopkins and welcome back to the Chinese Medicine Podcast. It's my pleasure today to be joined by Amy Forth. She's an expert in the area of fertility and Chinese medicine, acupuncture and fertility. Welcome, Amy.
Hi, thanks for having me.
Awesome. So Amy's the director of the Acupuncture Pregnancy Clinic in Alexandria. And she's also been involved in lots of research, investigating the use of acupuncture and IVF. And she's got a special interest in those areas. After she studied Chinese medicine, she went and did a master's degree in global health. And so she's got more of a, I guess, than the average practitioner. She's more interested in research areas of Chinese medicine. And so what's great about today's episode, I guess, is that we're going to help you. Amy's better than me at articulating these concepts, these research-based concepts, in her area of expertise. And so hopefully what you'll get out of today is to break down those possibly complex concepts. You know, you see a research paper is 5 pages, you're like, which bits do I read? Do I have to read all of it? Get to the end, think, that didn't make any sense to me. What does that really mean? So she's going to go through a whole pile of research papers, and we're going to talk about what does that mean for you as a patient. You know, is there efficacy around Chinese medicine? Is there research to support the use of acupuncture if you're going through an IVF cycle? How many treatments should you have? Those kinds of things. So welcome very much to the viewers and the listeners, and we hope you enjoy today's episode. Okay, so I want to ask you about the kind of treatment that people would expect. Like, what, let's say someone, again, that patient comes back to you and they're saying, I want to conceive, and you're like, okay, let's do acupuncture and herbs or acupuncture. What would they what should they expect, like a time frame, amount of treatment wise? I mean,
sure. So I can talk a little bit about the research around fertility, if that's helpful. So when it comes to like IVF and acupuncture, where there's been quite a bit of research conducted into the effects of acupuncture. So IVF and acupuncture, there's been quite a lot of research in this space. Back in 2000, I mean, a lot of people undergo IVF treatment. I think it's 1 out of every 20 births is now conceived through IVF in Australia, which is amazing. 1 out of 20. So that's like it might be 1 out of 20, 1 out of 25. We need to check that. Okay. But it's basically one child in every class is conceived through IVF. So that's massive. So if you are undergoing IVF, the first thing to know is that you're really not alone. There's a lot of people who are struggling to conceive. And so acupuncture and IVF, there was some research that came out in 2002 by Paulus, and what Paulus did is they conducted some acupuncture just before and just after the embryo was transferred when the patient was undergoing IVF. So there was pre-embryo transfer and post-embryo transfer acupuncture, right before and right after. Paulus found that there was a significant increase in the clinical pregnancy rate. It was 42.5%, and this is back in 2002, where IVF wasn't as good as it is today, and the clinical pregnancy rate was usually around sort of 25%. So it was a marked improvement in terms of what you'd expect. So the control group had a 26.3% clinical pregnancy rate in that study.
And just for people watching, because lots of people won't know, there'll be like lots of control group.
Yeah. So the control group didn't have any acupuncture.
Okay. Yeah. And sometimes control groups might have what they call placebo acupuncture or sham.
Yeah,
acupuncture.
that's right. And I'll talk a bit about that as well, because that can really change the results in terms of acupuncture. So sometimes in acupuncture studies, they'll try and use a control group where, they won't try. They'll use a control group where they've used sham acupuncture. And sham acupuncture, I've been involved in a little bit of research where we've used sham needling. And one example would be where we use a device where we pop it on the patient so they can't see what is happening. And we'll put it over the acupuncture point, and then we'll put in a needle, and they won't know if it's a blunt needle that will collapse into itself or if it's an actual needle that goes in.
So it gives the patient the effect of feeling as if they hopefully they won't know whether they really had it or not.
The idea is that it's double blind, or it's single blinded, because you can't blind the practitioner. Yeah, yeah, that would be problematic.
Bird box.
Yeah,
that would be good.
So the idea is that the patient doesn't know if they're having acupuncture or not. So you're not getting that placebo effect. However, it's been criticised quite widely now that sham acupuncture actually is not inert, which means it actually has a physiological response. And we know that even seeing patients, talking to them, and then being in a study, that also has an effect. So it's kind of like, well, we're measuring these two things. One, the needle's going in, and the other one, the needle's not. But what kind of effect does that needle have? So that's sort of the problem with sham acupuncture. And when you look at the results between the actual acupuncture group and then the sham, they're often, sometimes will not have much of a significant difference in with the differences. However, if you remove the sham groups and you look at a control group which doesn't receive acupuncture, you'll see that they're often, well, in the research that I'm going to talk about, it shows that there's a trend that if you use a control group which isn't sham acupuncture, that there's more likely to be show a significant benefit in the acupuncture group. So I guess that's the first 101 of looking at acupuncture research when it comes to the IVF space.
Because a lot of people see these articles, I see them bandied around the internet all the time. Oh, acupuncture's no better than a placebo. Yeah. And it's exactly what you were just explaining then. Yeah. Because the problem is the placebo for acupuncture is so similar to acupuncture that it's not really a placebo. Yeah. It's just it's not really testing that.
That's right. It's really contentious that it doesn't have a physiological effect. It's argued quite widely that it actually does have a physiological effect. So you're just arguing whether or not one version of acupuncture to another, which is if it has a significant difference.
So let's talk about the research that's been done since that.
Yeah, so 2002. But what happened with the Paulus protocol is because Paulus and his team did the acupuncture just before and just after the embryo transfer, they really created this trend in IVF acupuncture. And if you're doing IVF, you might have heard of this, the pre and the post embryo transfer. It's quite popular. And so from then, there was a lot of studies that replicated this trial. And it was up to about 12. And in 2012, Zhang did a meta-analysis of the trials which had replicated the pre and post embryo transfer research that Paulus did, and it showed while there was still some benefit with the pre and post, it wasn't a particularly strong trend. And so then he also analysed research which looked at acupuncture where there was higher dose, so that person would actually have acupuncture during the IVF stimulation phase, and then they have before and after, and found that there was a much stronger trend for there to be a benefit in terms of their a positive clinical pregnancy out of that cycle. So I've got a couple of diagrams for that. And then probably the research which has got the most amount of attention in Australia was the 2018 study that came out. That was quite a large study, and it was quite an impressive study. It had backing from the National
Whatever Institute of Health. NIH?
No. But anyway, it had backing, and it had 848 women, so quite a big group. So when we're looking at randomized control trials, you want about 1,000 people to kind of get a statistically significant sample. So it was quite a good study. However, with this trial, they were looking at sham acupuncture, which I've already discussed why that's sometimes problematic. And they looked at doing the pre and the post embryo transfer, and they also did one additional acupuncture session that was just during the stimulation cycle. And this study, instead of looking at clinical pregnancy rates, that is, i.e. you get a positive pregnancy test, I'm pregnant, they looked at actually live birth rates, which, as you can imagine, the live birth rate is going to be a more of a difficult variable than a clinical pregnancy rate. Some people are going to get clinically pregnant. Not all of those pregnancies are going to result in a live birth rate. So just keep in mind that this study, while it was quite a good study, it had some. It was probably like two things that people were a bit unsure about in terms of this study. So the first thing that it was comparing just an acupuncture group with a sham acupuncture group, which we know in acupuncture research sometimes isn't the best control group.
So there was no group that just had nothing?
There was no group that just had nothing.
Okay.
And the other thing which I'm going to talk about more was that we were comparing 3 acupuncture sessions. So just you go to acupuncture, you get 3 acupuncture sessions, and what we want from that, we want you to have a higher rate of live birth rate.
Yeah, right.
And so does that sound crazy to you? Because that sounds crazy to me. Yeah, it's kind of asking for a miracle. Yeah. And what this research showed is that acupuncture isn't a magic bullet, and that 3 acupuncture sessions isn't a therapeutic dose high enough to produce the outcome of a higher birth rate. And that's what it showed. However, then in 2019, Smith and some other colleagues from that National Institute of Complementary Medicine had a look at, they did a meta-analysis of all the research. And what they found is that with particular groups of women, that they really benefit from having a pre and a post embryo transfer, that they seem to have a significant benefit in terms of clinical pregnancy rate. So, and this group was women who were highly stressed or anxious, and the other characteristic was if they had a low baseline pregnancy rate. So that means that they had been trying to get pregnant and they hadn't yet conceived. So this group of women,
they couldn't conceive naturally,
or through IVF. So they might have had several rounds of IVF, but they had a low baseline pregnancy rate. So with these 2 factors, they saw that they actually had significant benefit when they got a pre and a post embryo transfer. However, when they looked at the rest of the research, it showed, in fact, there was a positive benefit for having acupuncture for women who had acupuncture more than 3 times during their IVF cycle. However, less than 3 times, there was no significant benefit. So that kind of brings into focus, I guess, what is the therapeutic dose and and what is needed to improve your fertility. That's what we're looking at. And that's what I'm talking to patients about all the time. I think maybe if you have, the research shows that if you have 3 or more, that you may have a more positive result in terms of you may have a higher rate of pregnancy. However, there's other research that has come out through Hollander.
Before you go to that, I'll ask you a quick question.
Yeah.
So would it be fair to say that having 3 acupuncture sessions, if that's all you're going to do, isn't really that beneficial?
Well, it says 3 or more. Yeah.
No, so, but just having patients that just think, I'll just have 1 or 2, and that's their first time ever to do it.
Well, no, it definitely needs to be qualified. Like I said before, the patients who have just the pre and the post, if they're in that group where they're anxious, or if they have a low baseline pregnancy rate, then they will get significant benefit out of it. And the research, the meta-analysis showed 3 acupuncture sessions or more is what was needed to have benefit from acupuncture in terms of fertility. So to answer your question,
people are really
it depends.
Highly stressed, they still could just benefit just from
the pre and post. And this is what we tell patients as well at the acupuncture pregnancy clinic. We tell them that when they call up and they just want to get a pre and post, we say it's absolutely fine. We can definitely offer that. These are the groups of people who benefit. And you might want to consider trying to get 3 acupuncture sessions or more before we get to embryo transfer, or before and including the embryo transfer acupuncture. But the Hollander research I really like. So Hollander did research. She did a retrospective cohort study, which means she treated or not her, but her and her team treated a group of women who were undergoing IVF, and they treated them not only with acupuncture, but they also gave them herbs and supplements. They just treated them how they normally would. Okay. She called this a whole systems approach. Yeah. So she treated those. For the average was about 12 acupuncture sessions that they had either before and during the IVF cycle, like leading up into embryo transfer. And Hollander compared this with just the with a group that were going through the same clinic, however they weren't receiving this care. Okay. So that was the control group. And Hollander was also measuring live birth rates. So Hollander found that the women who had undergone the whole systems traditional Chinese medicine approach, so they had the acupuncture, herbs, the supplements, they had a 61.3% increase in live birth rate. In comparison to the control, which was a 48.2%. And you can see how from 2002, where the baseline was more like 26%, this American clinic had a 48.2% in terms of their live birth rate. So it's a significant difference. That's just how much IVF's improved. It really has. So she also measured a group which just did the pre and the post embryo transfer acupuncture, and they came in having a slight improvement from the control group at 50.8%. Okay. So you can show. So I think this is a great study because it sort of shows that what pre and post embryo transfer might help you a little bit. That really that high dose acupuncture may be really beneficial. And this is what we really advocate in our clinics. Yeah. Often we'll see patients who are undergoing IVF, and they're often in a little bit of a rush because they want to start a new cycle as soon as they can. So we talk about this kind of ideally that kind of gold standard, if we can see them, is about 12 acupuncture sessions before and during their IVF cycle. Okay. So often this will result in us trying to see them about twice a week for about a month before, and then twice a week during their stimulation cycle. And this works quite well for people. And since I've started using this research in my clinical practice, and this research came out in about 2015, I've been doing IVF acupuncture for about 12 years, but I have definitely found that moving away from just seeing patients once a week and doing more the twice a week and really focusing on, let's see if we can do this like 12 sessions for your IVF cycle. Since this research has come out and this has informed my clinical practice, I have found personally that patients seem to have a much better response. And so I'm very happy to advocate this approach because clinically, I feel like I see some pretty good results with this. And there's research there to support it. Yeah.
And I think the other thing is, what this makes me think of is you're not using acupuncture so much like a vending machine style of I'm just getting my pre and post treatment. Yeah. Like a procedure that needs to be done on you. But people that probably, correct me if I'm wrong, but people that come for those longer treatments are probably more engaged in their own health and wellness in a Chinese medicine way because you get to talk to them each week and keep them accountable about their diet
they're like, and what about this? And what about pineapple core? Which is the question I always get.
Pineapple core?
Yeah. There's some research around it. I've never even cited the research, but apparently there's research around it. Yeah. Anyway.
But they have also that support from you, right?
That's
as a person to talk to.
Yeah, and that's like the randomized control trial that I talked about in 2018, while it showed physiologically the results were not that different, what it did show is that psychologically that women, there was another kind of arm of the study, and it showed that psychologically women did a lot better when they received that extra support through getting acupuncture. So I think that's something to keep in mind because as we mentioned before, acupuncture, no, but IVF can actually be quite stressful, and some studies have compared it to being the same level of stress as undergoing cancer treatment, which is huge. So anything you can do to kind of mitigate that stress and help you kind of get through it and keep things civilized for as long as possible at least, I think the better. And something I love about treating fertility is seeing patients when they walk out the door, the way they walk in, the way they walk out, vastly different stories. And that you can see that they have kind of relaxed, they've come back into themselves, and they leave feeling like human again, and you know, that they have kind of a sense of calm again, which is really wonderful to witness.
There's so much, unfortunately, in a way, and in a good way I like it, because it keeps that mystery of life there, but there's so much intangible benefits of acupuncture that it's really hard to show, like what we were talking about before about that heart and uterus connection. Like these intangible benefits that people have that you can report on them objectively, like, you know, you walked in feeling crappy and you came out feeling better. But how acupuncture is actually doing that, we don't really know exactly how to articulate exactly how it does that. Right?
Yeah, that's true. I mean, I think the thing is with science is that they're often trying to look at like kind of one thing that's changing, and often in acupuncture there's a whole cascade of events that are occurring. But we know that like with acupuncture it can increase like the endogenous opioids, and we know that like part of the reason why it might help with fertility is that it can also increase the endogenous production of sex hormones like estrogen. And we know that sometimes where we put the points, for example, sometimes when we put points over the ovaries and the uterus, we know that that causes kind of new blood vessels and increases the microcirculation and the blood flow to the ovaries and the uterus. So there's there are some mechanisms that have been identified through research. You're right, that like because often with biomedical research, they're looking from a very reductive, biological reductive. They're trying to see what is the mechanism that has been affected, and sometimes there's several or quite a few.
And that's hard in a study. You want it to be as objective as possible. You don't want all those variables there. You want one variable that's going to help it.
That's right. Just one at a time. But Jane Littleton, who's the director of the Acupuncture Pregnancy Clinic, she does a great talk about stress and IVF, and goes into quite a lot of detail about endocannabinoids and how acupuncture may play a role in different mechanisms around stress. She does a wonderful talk, so
awesome.
Hopefully you can get her to talk about that one day. But I mean, we see it clinically every day. We see how our patients, as acupuncturists, we see how our patients leave, and it's so satisfying that they're going home feeling really relaxed and really comfortable and calm, and with like, you know, a sense of balance again. It's great.
This is so informative. Like, I think, thank you so much for sharing this, because I think one is like there, for a lay person, let's say, or just a person wanting to embark on this journey, and unless you are an academic, it can be really hard to understand the research. And then additionally to that, there's all this sort of, like, I see these things pop up on Facebook all the time, like, you know, just headlines of research papers, and it's really hard to know.
We all just read the research.
News.
Yeah, we just read the headlines.
Coffee's good for you. Coffee's bad for you. Alcohol's good. Alcohol's bad.
And probably, that's probably almost the first question we'll often get when we get inquiries, is people go, what is the research behind it? We've actually created a blog on the Acupuncture Pregnancy website that I wrote.
I'll put the link below for that.
And Jane Littleton and myself kind of collaborated and wrote that, and just kind of giving a summary a little bit in a little bit more detail than what I've talked about today about the research around acupuncture and IVF, and what might be helpful and when to come in and why. And it's a great website in terms of if you're a bit of a nerd like me and you like reading research. It's a great website for that. But the blog helps kind of, it's for patients, so they can have some sort of sense of what to do.
And, well, I mean, I guess having we talked at the start about, like, you know, Chinese medicine's like this thing that's been around for 3,000 more years. There's a lot of empirical evidence. There's history of use. It's been in use for a long time. So there's a lot of safety and efficacy just because of that longevity of use, particularly in like let's say herbal formulas that have been used, you know, unadulterated that whole time, like that. Those kinds of things. But then our Western brains want to know Exactly.
Yeah.
Like, I
And
want to know why
and
it
they-
works, how it works.
Yeah.
And it's good to have that. And
I
that
think it's good to have
overlap of
both. And
of those
I mean,
things.
I'm a massive advocate of integrative medicine, and I love science, and I love working at an IVF clinic and hearing, like, talking to the embryologists in the tea room and hearing all about the latest science. Like, I love it.
Yeah.
But I think what is great is that, you can bring this, like, kind of, this body of knowledge that's so huge. Like, Chinese medicine is huge. You could spend a lifetime and you'd get through 10% of it, maybe. Like,
We're still studying.
yeah, it's an enormous an enormous wealth of knowledge there. But then we can combine that, and like I said earlier, when Hollander did that study, I felt a lot more confident asking patients or saying, look, this research has come out, and I think it might be advantageous for you to come in the research. They saw patients 12 times before and during this. Why don't we try that? And that can really inform our clinical practice and help us make really good decisions.
Yeah.
And also give our patients a little bit more than, rather than me just telling you, then there's actually there is research, to back it up. So I think there's a real place for research alongside us really kind of valuing what a huge body of knowledge which has come before us. And as Chinese medicine practitioners, I just feel incredibly privileged to be able to access that, and all these textbooks on my shelf over there that, some of them thousands of years old. Like, we're very lucky.
Yeah, awesome. Okay. Yeah, so wow, that research just sounds really, really interesting and so informative. And because this is your field of expertise, are there any other relevant research papers and things that our viewers might be interested in knowing about?
Yeah, for sure. So I mentioned mentioned Hollander, but there's other research around dose and affecting fertility outcomes. So there was one...
dose of acupuncture or herbs? Or?
Yeah, sorry, the dose of acupuncture.
Yeah, okay.
So, I mean, often people think about dose in terms of maybe like herbal medicine or medication, but acupuncture is actually no different. It has a therapeutic effect that's exerted. However, we need that in like a therapeutic dose in order to get the desirable outcomes.
Yeah, how many treatments do people need? That's what they want to know.
Absolutely. And often in acupuncture research, the dose is normally, it varies a lot, but I'd say that somewhere between sort of 8 to 16 acupuncture sessions is, would you say that's probably fairly common in acupuncture research? So the research which we talked about prior, the randomised controlled trial of 2018, it's fairly unusual, where it was measuring a dose of just 3 acupuncture sessions. So other acupuncture and dose studies include the Steiner Victoria in 1996, which showed improved ovarian blood flow after 8 treatments. And there was also an Electro acupuncture study conducted by Jewel in 2011 that showed after 16 weeks of treatment, it helped regulate menstrual cycles. Acupuncture helped to regulate menstrual cycles.
So just for people that don't know, electro acupuncture, we're not electrocuting you with acupuncture. Using, so if you've had regular acupuncture, you've seen it. I'll put a little picture on there so you can see it. You might see people connected up to little wires, like little electrodes, very similar to a TENS machine, but it's basically sending that pulsing through the needles. So it's like continual stimulation of the points.
And it helps just more activate the points and stimulate the points a little bit more. So it's, it's just a tiny little electro current. And sometimes that feels like a flutter, and sometimes it also could feel like if it's up very strong, it might feel like more of a pulsation.
If you've had a TENS machine, you've put it up too strong, that would be like the extreme version of how it could go like that, but that's not how we normally have it.
Often with our patients, they'll just feel a little flutter on the needle. And just kind of make sure the needle's like active. So there was low frequency electroacupuncture. So that was for 16 weeks. And it decreased hyperandrogenism.
Androgenism.
Yeah,
I couldn't even say that either. Androgenism.
And regulated menstrual cycles. And then acupuncture increased ovulation frequency in PCOS patients with 10 to 14 weeks of treatment. And in that one, they did it twice a week. And that's Johansson in 2013. So there's some there's some research out there that supports that, you know, doses may be quite important and help improve reproductive outcomes. We haven't talked about male fertility at all today, but that's a whole nother talk, but it's similar. The research reflects kind of similar results.
We'll have to have you back on to talk about male fertility.
Yeah, sure.
Because I'm sure there's men out there that want to know.
And I think the number one thing to tell if your partner does have poor sperm quality or poor motility, acupuncture and herbs can be really helpful, and we do not put the needles on the genitals. Okay. That's like the number one thing to tell all men.
Is that I've not had that question from
I have had that question.
People.
I've had that question many times. So the needles for most fertility treatment, either male or female. Generally, we'll be doing points on the arms and the legs, and then we'll do some points often over the reproductive organs on the lower abdomen.
So just below the belly button,
Just below the belly button, above the pubic bone. So that's usually the location of the points when you're getting fertility acupuncture. The other thing I haven't mentioned was the research around electroacupuncture prior to a frozen embryo transfer. For those who are undertaking IVF, they may end up with frozen embryos, and then before they are transferred, there's research to suggest that having electroacupuncture before the embryo is transferred can be beneficial. And from 6 to 12 weeks prior to the embryo being transferred is the recommendation, from once to twice a week. And what the electroacupuncture is can help with is the endometrial lining. And in particular, it's the subendometrial lining, so the lining underneath the endometrial lining. So the endometrial lining is the lining of the uterus where the embryo will then implant into. So it's really important that this is really healthy and really vascular and receptive for the embryo to implant. And so electroacupuncture prior to embryo transfer is helpful in terms of, at that point, you're not trying to optimize follicular development as you would be in a stimulation cycle, but at that point you're trying to optimize endometrial development. And the acupuncture, the research around that suggests that it helps improve the subendometrial layer. So the endometrial layer in the uterus is what the embryo will implant into, and you want it to be very healthy and vascular and receptive for the embryo to implant. And the subendometrial layer is the layer, the next one, and that's going to help kind of feed the endometrial tissue. So that's why acupuncture may be helpful for prior to a frozen embryo transfer. And the recommendation there is to 6 to 12 weeks prior to the frozen embryo transfer, coming in once to twice a week.
Yeah, okay, awesome.
Yeah.
That's been so helpful. So we'll put all the links to these things below, so you can kind of look at that, and you can jump onto Amy's blog and see because you update that with new stuff that's coming. And kind of stuff, right?
Our website's a great resource for anyone who wants to do some research.
Yeah. Okay.
And we've got some blogs which are really just kind of like putting it all together for you, because not everyone wants to kind of look through all the different studies.
So you break it down a bit easier for the average Joe to kind of look and see.
That's right. And so, I'm the director of the Acupuncture Pregnancy Clinic in Alexandria, but Jane Littleton is the founder of the Acupuncture Pregnancy Clinic. We've got 5 clinics throughout Australia. And Jane Littleton is known in the IVF space. She's a pioneer when it comes to kind of integrative fertility, and she authored the book called Infertility and the Use of Chinese Medicine, which is used as a textbook for Chinese medicine degrees all over the world. So she's the founder, and she has trained everyone, all the practitioners at the Acupuncture Pregnancy Clinic. So we're really lucky to have her as a resource.
What a great mentor.
Yeah, she's
got
great.
The textbook as the mentor.
That's right. We have her and she's she was a geneticist, a scientist to begin with. So she came from a science background into Chinese medicine. So she really brings that kind of integrative approach, which I love, and I love working with her. So we're really lucky to have her. So she's the founder of the Acupuncture Pregnancy Clinics. Yeah.
Cool, awesome. Well, it's been so lovely to talk with you today, and I'm sure our listeners and watchers will really enjoy this content. This is super informative, and I think it's helped to break down like some of those barriers about understanding research and really knowing what's out there, and you know what's the best, especially how many treatments people need to have, you know, and what's the optimal kind of thing for them to do.
Great.
So thank you so much.
Oh, thank you. It's been wonderful having an opportunity. I just love getting Chinese medicine and acupuncture research and information out there for people. So thank you so much for doing these podcasts. What a great idea. They're wonderful.
I love it. I love talking.
It's been great. Yeah. Thank you.
Awesome. Oh, cool. And so if people want to find you, so you're in Sydney, we're in Sydney now.
Yeah.
How would they find you if they want to see you as a patient? Or
sure. I have 2 clinics. One's Amy Forth Acupuncture. So they can look up my website, which is amyforth.com.au, and the other clinic is in Alexandria at Alexandria Specialist Day Hospital, and that's the Acupuncture Pregnancy Clinic, Alexandria. We've got several clinics, and you can look up the website is acupuncturepregnancy.com.au.
Yeah, no worries. We'll pop the links to all those things in the description below somewhere in this video.
Awesome.
See that? People love clicking. Click on the link.
Yeah.
And while you're there, click on the link to subscribe to the channel if you haven't subscribed already. Make sure you click that notification bell so that you don't miss a video from us. And if you've got a question, pop it in the comments. If you've got something that you'd like to ask about what we've talked about, and I'll attempt to answer it. And I might hit up Amy if I can't answer it.
Sure.
Because we just love hearing people's questions, and that's how we come up with the content for this channel. Like most of the time, people put their comments in there and they ask questions about what they're interested in. And so, that was wonderful. And so, people can find you at your 2 amazing clinics in Sydney.
Great.
And thank you so much for being here and giving up your time to do this.
It's been great.
Yep,
Thanks
awesome.
so much.
All right.
Have a great day, everyone.
Thank you. Bye.
Thanks.
Thanks for listening to the Chinese Medicine Podcast. Did you know we're also on TikTok? And you can find shorter videos on Facebook and Instagram that you might like to share with your friends and family. You can also find our podcast on Apple, Spotify, and all places where you listen to audio podcasts. I look forward to seeing you again on the next video soon.